Hello and welcome to the last in the series of the online education series from Salts Healthcare. In collaboration with the RCNi, Salts Healthcare have been busy working on some stoma care related decision support tools and continuing professional development modules. The decision support tools are an interactive online and mobile resource that support registered nurses and healthcare professionals with evidence-based clinical information at the time and location of decision making. Dr. Richard Hatchett from the RCNi is going to explain a bit more about all of these exciting new resources, how they can be accessed, and how they can be used to their greatest potential. Dr. Richard Hatchett is a registered nurse and the senior nurse editor for the RCNi, the multimedia and publishing house of the Royal College of Nursing. He has worked primarily in cardiac and intensive care nursing, in higher education, and is the former head of education and standards at the Nursing and Midwifery Council and deputy head of school at the Royal Marsden Hospital. Richard has published widely and led the team working with Salts Healthcare.
Hi everybody, this is Richard Hatchett and I'm a registered nurse and I'm the senior nurse editor at RCNi. And RCNi is the publishing house of the Royal College of Nursing, and some of you may have known that as RCN Publishing in a previous life because we've been around for about 30 years. And the move to RCNi represents that we're very much a digital company, which means that most of our material is accessed online. And I'm here today to talk to you because we've been working with the Salts Healthcare team for well over a year now with their expert nurses on 5 different pieces of learning material that we know will be of use to you and for nurses generally. So what I want to do today is tell you a little bit about the platforms, so you've got an idea what we're talking about. We'll pop some slides up so you can actually see. And we're then going to, after this presentation, we're going to hear from Carol and Breege, who've worked with me on the High Output Ileostomy, CPD, which is continuing professional development, a traditional style of module, and also a decision support tool, which is another of our platforms, which helps people make decisions, best practice decisions, in the heat of the moment. So we sometimes call that a point of care tool. There's some good news here. One is that you can access some of these modules free online. So if you don't have access to the platforms that I'm talking about at the moment, if you make a note of them, you can access them via Google and you can actually see the platform itself and you get some sample modules so you get an idea of how the platforms actually work. For many of you, you'll access through 2 means. One is that your organization may have purchased the platforms, which means an administrator will help you with username and password. But again, good news is if you lose your password, as with other platforms, you can go online and reset that. Or it might be you're an individual subscriber, exactly as you do with a journal. So you may be accessing that way. And people have different access to different platforms, etc. So I'm going to go through the 3 platforms today: RCNi Learning, the decision support tool, and also the RCNi portfolio. I'll say a little bit about that. And that's a portfolio that's used for all of us when we're revalidating. So that's incredibly useful in having everything in one place, putting that together, and then you can keep that on your laptop or computer on a stick, and it's everything you need to remind you how to do your revalidation. So that's what I'm going to go through. I'll just say a little bit more about RCNi. We are, as I said, the publishing house of the Royal College of Nursing, and we produce 11 journals, including Nursing Standard, which many of you will know. And I mentioned that one because one of the pieces that we've done, a 6th piece actually, with Salts Healthcare is how to change a stoma bag. And we've actually released that in Nursing Standard, and that is the country's biggest selling journal in nursing. And so that's reached a high audience, and that was released in the summer. But we've also created how to change a stoma bag as a how-to module as well. So it reflects the different ways that people access material. So first of all, I did want to say a big thank you to all of the team at Salts Healthcare. It's been an interesting journey, and I'm sure Carol and Breege will we'll talk a little bit about that. But they've been absolutely fantastic, and it's great to bring the skills together of an editing team and also the expertise of the stoma nurses, the specialist stoma nurses. So we're extremely thrilled with these. So it's great to be here today. Okay, well, let's first of all start talking about the RCNi Learning. Give you some background to that and what it is. It is an online learning platform of over 200 modules, and this was first launched in 2016. But the great news is we've just gone through a big process of updating all of those modules. The modules are what we call double-blind peer-reviewed. I can get that out, double-blind peer-reviewed, which means an expert nurse, usually a nurse, sometimes another healthcare professional, will write the module, then it's double-blind peer-reviewed. That's a term that many of you will know, and it just means that it goes out to an expert such as yourselves to review it, and that expert doesn't know who's written it, and the person who's written it doesn't know who's reviewing it, so they can concentrate on the material. We're quite unique at RCNi Learning in that it goes then to an additional review process, and it goes to the Royal College of Nursing, and they go through their accreditation process. So it goes out to people like you, it goes out to additional people to get it reviewed, and then they will make any changes that they think that would enhance the learning for everybody. So that's fantastic as well. It's a very highly reviewed tool. Do remember with all learning products, and here we are talking about the decision support tool and RCNi Learning, that it's principled learning. So it's not a didactic tool, it's a guide. It presents best practice, but also refers you to local practices and local guidelines, because as we know, in context, things do change and there isn't just one way of doing things. So RCNi Learning, online platform, over 200 modules on a whole range of subjects. About a third of these relate to children, and about half relate to the community, and about half to the acute care environment. So when we're talking about, when I say about, it's because, as you know, some modules can fit into both camps and will address both issues. So we wanted to work with Salts Healthcare because we needed to enhance, we felt, for all nurses, including specialist nurses, our stoma care delivery. We already had 2 modules there written by Jenny Birch, who many of you will know as the education lead down at St Mark's Hospital in Harrow in Middlesex, and Jenny has recently updated those modules as well. So in fact, we now have about 8 pieces, 7 or 8 pieces online, which is fantastic. I'll just tell you now, because you'll be wanting to know what are those particular pieces. The pieces we've worked with Salts Healthcare are High Output Ileostomy, as we've said. One is a CPD module, a traditional module. One is a decision support tool. We also have How to Change a Stoma Bag as an article, and also online, slightly different online than how to, come on to that. And we have ileostomy blockage and colostomy blockage, and those are decision support tools. So RCNi Learning has 2 types of module. The majority are CPD modules, which is traditional, what you tend to see, where you have aims, learning outcomes, and then you have boxes that you can reflect on your practice and so forth, and then it will take you through best practice in that particular subject area. And RCNi Learning, as well as the stoma, has a whole range of subjects, managing hypoglycemia, from giving an injection to care of patients with dementia, respiratory problems, children with high fever, communication skills, how to write an essay, all sorts of different material that people can pick from depending on what they need at the time. The CPDs are quite unique in that they have at the beginning of them a pre-test and afterwards a post-test. So these are 10 multiple choice questions, written and reviewed again, and you take those at the beginning just to see where to pitch your sort of knowledge base, and at the end you can take it again. And of course sometimes these are just instant recall, but particularly at the beginning it does remind you of how much you know, and you can therefore reflect on your own learning. So the CPD modules are traditional looking modules, but they have a pre and a post test, aims and learning outcomes and so forth, and lots of boxes within them where you can write notes and so forth. Remember also that's brilliant for revalidation, and each module will take about an hour to complete, and that's great for obviously your CPD learning. So there's lots that you can use it, and do remember also you can use it as a reflection. As you know, your 5 reflective pieces in revalidation, you can choose a piece of CPD, you could do all 5 reflections of CPDs, but you can use all this learning to go towards your revalidation. So that's the more traditional CPD module. And also on RCNi Learning, we have about 40 how-tos. And these are shorter, and they're procedures. They go through how you should carry out or undertake a procedure. And we talked about giving an injection, but here an example would be how to change a stoma bag. And then following that, within that how-to module, is an evidence base, so the latest evidence. We all know, you know, and I know that there's not always evidence. So sometimes it's literature, sometimes it's the best evidence we could find to support that. And it's actually quite useful because we can also see where the gaps are in evidence and the evidence base. So the RCNi Learning, over 200 modules, which you can access. You can come in and go out and finish them and so forth. You can get a certificate at the end when you've done the learning, which you print out, and it doesn't tell you what your score is because that's personal to you, because in my opinion, if you've got 3 out of 10, you can see your learning need. If you get 10 out of 10, maybe you move on to learn something else. So it's always useful, whatever the score, but it will give you a certificate which you can download and use as part of your revalidation. So it's a highly flexible tool. Now, the decision support tool is more recent. It launched about 18 months ago to 2 years ago. And this is over 100 much shorter support, rather like a friend in your pocket or aid memoir. And these are much more like a protocol that's been brought to life. When you're out there in the practice setting, you might encounter a situation where you're not quite so familiar with what you're doing. For example, a nice example is if you were managing somebody who was hypoglycemic and you have a broad understanding of what you need to do, but it would be good to have a friend on your shoulder or in your pocket, just reminding you of the things you need to do in making those decisions. So the decision support tool is at the moment 100. And as we were saying, we've worked, for example, with Breege and Carroll producing High Output Ileostomy as a decision support tool, and also with other colleagues producing ileostomy blockage and colostomy blockage as decision support tools. Do remember, what you're not having with a decision support tool is a large amount of evidence base. What you're having is bullet point forms of best practice things you need to do, because it's meant to be a quick, efficient friend in your pocket at the point of care. I've always been quite broad about that term, point of care. It might be before you see a patient, you go into the decision support tool to remind yourself. It might be that you reflect afterwards on what you've done. So point of care is quite a broad term. The decision support tool, although this is also true of RCNi Learning, is designed to be used on mobile devices, tablets, on your phone, etc. And the good news is, once it's downloaded, once you're out of internet range and it's not able to pick up the internet, it will still work once it's been downloaded. When you move back in, if there's any updating to do, it will update. So we particularly wanted to work with Salts Healthcare on decision support tools because we wanted a snappy, focused, friend in your pocket to help people and nurses rather than healthcare professionals to be able to make sure they were both giving high standard of care in sometimes quite precious situations, but also to be able to reflect revalidation, but reflect on their practice as well. So the decision support tool is incredibly useful in that way. But just to remind you, it won't give you a detailed evidence base, it's best practice. So what it does do is when you encounter a situation, it asks you a series of questions and you tap in yes or no. You can go backwards and forwards, so it's absolutely fine. So there are different pathways, so it's quite slick. So if, for example, you were working in a situation where you've got high output ileostomy, and I know Breege and Carroll will talk about this, it will ask you a series of questions. What are you getting? What are you seeing when you're undertaking your assessment? What to look for? All of them have red flags because we all know that there are in some situations where you have to act very quickly and you may need to refer on quite quickly. So right at the beginning, it will identify the red flags that remind you that this is an urgent situation. And some of the responses to that the decision support tool will give you might be referring to a more specialist colleague, calling an ambulance and so forth, depending where you are. I always remember that managing hypoglycemia has about 15 different pathways within it. You wouldn't look at them all, but behind in the works, there are different pathways that you can take. And it all depends on the questions you, or the answers to the questions that it's asking you. Remember, if you think, well, I'm not sure, you can go back. In RCNi Learning and in the decision support tool, there is a reference list afterwards, there is a glossary, there is further reading, so that when you're using these tools and you think, I really need to know more about that, you can take that upon yourself as a professional to see what other and further reading you can do. Also on both of these are what we call the hover device, which means if there's any terms that you're not sure about, for example, hyperglycemia, glucagon, and those sorts of things, you can hover your mouse over and a little box appears and gives you a short description or a definition. If you don't need that, you just whiz through. So it's very intuitive. It works with you depending on what you particularly need. So the decision support tool, quite new, quite innovative. We believe there is not another nurse-led decision support tool, certainly like this, in the UK. We've seen adaptations from the medical profession to those sorts of tools, but this is written by experts such as yourself in those areas that they're experts in, and again, reviewed and looked at, blind reviewed by experts in those particular areas. So the decision support tool, very exciting, and we'll be interested very much as you use it to see what you think about how user-friendly it is. We're always very much as a team developing those tools. So RCNi Learning, 200 modules, more traditional decision support tool, much more snappy and focused, further reading there if you need it, but it's meant to be used and help you in making decisions at the point of care where you are. So that's particularly useful. Finally, I just want to touch on the portfolio. I've been asked just to mention a little bit about this because some will have access to that, some may want access to that. This is obviously to support in revalidation. I'm due to revalidate next year, and it's something that I'm using. The idea behind the portfolio is instead of thinking, where do I start? I've got to get my ring binder file. I've got to get those documents from the NMC. It's all in one place electronically, which allows you to fill in the box, download documents, and little timelines work across telling you how many more hours you've got left of CPD, participatory and non-participatory split, and helps you with your reflections as well. And of course, it does use the required NMC documents. So that's particularly useful in allowing you to have a portable portfolio rather than having something, a ring binder file in paper form, which it's more cumbersome, and the next year you've got to redo the whole thing again. Or rather in 3 years' time. Whereas with the portfolio, it's much more flexible. You can access it at any point. You can put it on a cloud. You can do whatever you want with it. As you well know, I was a former head of standards and education at the NMC. When they launched revalidation, the NMC will not require to see your file. It's very rare. Sometimes they do as a random, but on the whole, as part of the normal process, they don't. So to be able to have that in one place and be able to see what you've done for your own personal development is particularly important. So really, kind of in summing this up, it's been a very exciting year to 18 months working with Salts Healthcare. We feel honoured to work with those expert nurses. They brought the expertise to the table. We brought the editing ability and a working knowledge based on our analytics of what the nursing workforce needs. So it depends what really your level of practice is, or what your role is. With the pieces that have been developed, it may be that it is a junior nurse particularly wanting to make sure that their best practice in changing a stoma bag is good, which we think will probably be the most popular because that will affect most nurses, through to those junior nurses who may be encountering high output ileostomy or blockage, etc., and wanting again to be providing the best care. Or it might be an expert nurse who is a clinical specialist who's just saying, I wouldn't mind reading that just to see if there's anything else I need to update on, or to benchmark their practice against what we regard as best practice. We're very flexible with that, very open to any changes as it occurs. So when new guidelines come in, we can do that on the platform quite quickly, so it will always remain up to date. But also, as we've said, it's very much developmental. So we always welcome your comments. We're all in this together. If you feel something's not clear or something has changed that isn't in there, please let us know and email us so we can keep this as a living document. And that's the advantage of these tools on platforms. Rather than a book that sits on a shelf for 4 years, we can periodically review these. We review every year, and we check links work. We look for anything, sort of a mini review. And then we do a big review every 2 years and take it back to the author and they update it. But of course, tomorrow a new set of guidelines could come out. And rather than just dropping them in, we will ask the author and say, what's your view on this? And they may say, just put it in the resources. It's not a particular document. Well, yes, we need to update and change as well. So it's an ongoing process that we would very much welcome everybody who uses our tools to be an active part of as well. And now I think Carol and Breege are going to talk to you about the high output ileostomy, the CPD module and the DST and their experiences of that. So please enjoy.
I think many of you will agree that having access to such resources will be extremely valuable to ourselves, as well as some of our colleagues whose speciality may not be stoma focused. I too have recently gone through revalidation for the second time and have used the portfolio facility that Richard mentioned, which I found extremely valuable and would highly recommend. We will now be carefully guided through one of the specific modules on management of high output ileostomy in a community setting, written and developed by Breege Neill and Carol Althorp, both Salts Medilink Stoma Care nurses.
Hi, my name is Breege O'Neill. I'm a stoma care nurse for Salts Healthcare. I'm currently working in the community in North London, and I have over 12 years stoma care experience, both in the acute and the community setting.
Hello, my name is Carol Althorp. I am a clinical nurse specialist in stoma care, employed by Salts Healthcare, and I work at Croydon University Hospital, based in the hospital and also covering community. I have had 12 years experience in stoma care.
So welcome to this session on management of a high output ileostomy. Within stoma care, a high output ileostomy can greatly affect patients' quality of life and adaptation to their stoma. As stoma care nurses working in both the acute and the community setting, we feel it is very important to increase the knowledge for healthcare professionals in identifying, managing and supporting patients with a high output ileostomy in order to minimize further complications. Together with my colleague Carol Althorp and in collaboration with the RCNi, we have devised 2 available tools which can be used to support in the assessment and management of patients with the high output ileostomy, both in the acute and the community setting. These are the learning module and the decision support tool accessed through the RCNi. So learning module and decision support tool. Both the CPD module on care and management of adults with a high output ileostomy and the decision support tool are user-friendly tools aimed to supplement patient care both in the community and the hospital setting. They are designed to be used alongside your own clinical judgment and local policies and procedures. Both are RCN accredited and help to improve skills and professional development, which can also be used when revalidating. They can be accessed via a desktop or for ease of use via an app on a mobile device. Target audience include qualified and student nurses, together with any healthcare professional who has a patient with a high output ileostomy on their caseload. This can include nursing home staff, community dietitians, and district nurses. Clinical Practice Development Module. The CPD module is a learning tool which can be accessed at home as part of professional development or in a patient's house to enhance patient assessment. The module follows a series of multiple choice questions which assess knowledge and are readdressed on completion of the module. There is also a selection of timeout activities throughout, which help consolidate the learning points, as you can see here on your screen. All work is saved and logged online, with the module taking approximately 1 hour to complete, and can be added to your portfolio as evidence for revalidation. Decision Support Tool. The Decision Support Tool supports in effective decision-making when managing a patient with a high-output ileostomy in the community setting. The DST is an easy access resource accessible on a mobile device, which takes the form of a flow chart, as you can see here, where step-by-step initial and ongoing assessments are completed and any red flag or concerning issues identified and escalated further if necessary. On completion, the assessment summary can be saved as a PDF and added to patient's notes to support documentation and planned care. The DST is an excellent way to enhance communication between healthcare professionals in the community and deliver best practice for patients. With our combined experience in both the hospital and community settings, we feel these are very essential tools, especially for those working independently in the community setting. They help to support decision-making and patient assessment and improve patient care. We are passionate about stoma care and the timely management of patients experiencing a high output from their ileostomy, which may prevent further complications and in some cases hospital readmission. This is very true in the current challenging times where patients are being discharged early through enhanced recovery programs and often with limited support, and also the current challenges surrounding the COVID-19 pandemic. The following presentation will aim to highlight some of the issues and management of a patient with a high output ileostomy. An ileostomy is where the small bowel is diverted surgically, resulting in a stoma at the ileum. A high output ileostomy is regarded as one that passes more than 1 litre in 24 hours. Classification of a high output ileostomy varies between texts, but generally it is regarded as over 1 litre to 1.5 litre output in 24 hours. This is also in conjunction with your own clinical judgment and individual patient assessment. High output may result in the small bowel being unable to absorb sufficient electrolytes, also dehydration, malnutrition, and renal impairment or acute kidney injury. Hydration for a patient with an ileostomy is more complex due to the fluid not being reabsorbed by the large bowel. This module discusses the problems, complications, and effective management of a high output ileostomy. The learning outcomes from this session include to be able to recognize the signs and symptoms of dehydration and why a high output ileostomy may be a concern, to be able to manage and support patients with a high output ileostomy, and also to identify when it may be appropriate to refer patients for further medical advice and treatment in both the acute and the community settings. A high output ileostomy may be caused by a number of issues. Some of the possible causes include post-surgical intervention or ileostomy adaptation, high output following surgery, and stoma formation can occur within the first 2 to 3 weeks of surgery and generally resolves after a few days with minimal intervention as the ileostomy adaptation stage takes place. Appropriate diet and fluid advice is encouraged post-operatively. It is very important to address electrolyte imbalance and dehydration early in order to prevent further complications. Short bowel. The amount of functional bowel available can affect ileostomy output. Generally, the shorter the length of small bowel, the higher the stoma output. Diet. A diet high in fibre will have a faster transit time, leading to a higher output and a risk of dehydration. Low fibre foods are encouraged, and a limit of hypotonic fluids, such as plain water, is important to aid absorption and reduce stoma output. Infections such as Clostridium difficile and abdominal sepsis can increase stoma output and need to be managed as soon as possible. A patient with active Crohn's disease and inflammation can often result in having a high output from their ileostomy. Various medications can also have an impact on stoma function and cause high output. Examples of these medications include laxatives, magnesium or iron supplements, antibiotics, the sudden withdrawal of steroids, or the reduction of opioid medication. And also side effects of chemotherapy and radiotherapy can also cause the bowel to become inflamed and lead to a high output ileostomy, for example, in radiation enteritis. I'm now going to hand over to Carol, who is going to discuss the signs of dehydration and high output, and also the management of a high output ileostomy.
Signs of dehydration and high output. Early recognition of the signs and symptoms of a high output ileostomy and dehydration are crucial in the management of patients with an ileostomy, so that the electrolyte imbalance and dehydration can be addressed within the first 12 to 24 hours. Signs of dehydration include a patient having increased thirst and maybe a dry mouth, headaches, feeling faint and or dizzy, and may also be an indication of dehydration. Reduced urine output or a concentrated output is also a possible sign of dehydration. For an ileostomist, we would also consider further signs of dehydration or high output to include appliance leakages. Pouches leaking due to a more watery stool may highlight a problem of dehydration and high output. Skin irritation and soreness. Leakages and watery stool may have caused skin irritation and soreness around the stoma, resulting in increased soreness and discomfort from the patient. Type 6-7 stool is a concern, particularly if it is nearer the type 7 stool, as this would indicate the output is watery. We would use the Bristol stool chart to illustrate this. Output of more than 1 litre in 24 hours. The ileostomy output, if it has become more watery, may be over 1 litre in 24 hours, and therefore an indication of possible high output. As previously mentioned, post-surgery, the ileostomy may take time to adapt to the ideal stoma output. It is crucial that electrolyte imbalance and dehydration therefore is addressed to prevent further complications. When assessing patients, if the above signs of dehydration and high output are not resolving, escalation for further medical advice and treatment needs to be actioned promptly to ensure the patient's condition does not deteriorate. Management of a high output ileostomy. A patient who is increasingly emptying watery stool and has symptoms discussed previously needs timely, appropriate action to restore normal bowel function, manage dehydration, prevent leakage and skin breakdown. High output appliance. A high output appliance will enable easier monitoring of stoma output and enable the peristomal skin around the stoma to be properly assessed, so reducing leakages and improving quality of life for that patient at this stage. Blood biochemistry results will indicate possible signs of dehydration and the severity of an AKI, acute kidney injury. Urine sodium should also be included to help in this assessment. Intravenous fluids can be commenced for a hospitalised patient with an accurate fluid balance. For a patient at home, asking them to record the volume, frequency of emptying pouch and consistency of stoma output is crucial in their assessment. If there is any suspicion of Clostridium difficile, a stool specimen should be sent for MC&S. Restriction of hypertonic oral fluids. For example, plain water are generally reduced to 500 to 1,000 ml in 24 hours. Medications need to be reviewed with the medical team or GP. Advice would include to stop non-steroid anti-inflammatory drugs. All laxatives should not be given. To consider including loperamide to slow the transit time and increase absorption, dependent on clinical assessment. Omeprazole may also be prescribed. IV fluids may be continued until the stoma output is reduced. Dietary advice would include a low-fibre diet, which helps to reduce the transit time through the GI tract and improve absorption. Isotonic drinks can be included, such as Diarylite, St. Mark's electrolyte mix, Oxford solution, Lucozade Sport. These should be used as per local policy and guidance. Ongoing daily reassessment is required of the stoma output and fluid balance alongside daily biochemistry. In conclusion, for nurses in hospital and the community setting, it is important to understand ileostomy function, so they are able to support and educate their patients. Stoma nurses are a good resource to ask for guidance alongside medical staff. Nurses need to recognise the symptoms of high output to help prevent complications. Electrolyte imbalance, management of dehydration, and reducing intestinal changes are vital in patients' management. In conclusion, good management will help to prevent leakage, improve quality of life, and reduce ongoing complications. Thank you for listening and hope you have enjoyed the presentation. I also hope that you have taken some key elements that you may be able to use in your own practice in the future.
This episode is able to be viewed on demand at the Salts Healthcare website, so it can be stopped and replayed at your convenience, giving you the time to write notes or reflect on certain aspects of the session if required. If anyone has any follow-up questions, then please do email us at discover@salts.co.uk and also use the same email address and complete the evaluation form to get a certificate of attendance. It has been a pleasure working with our speakers to deliver this range of educational videos for you. I do hope you found all 4 episodes of the Discover series brought to you from Salts Healthcare interesting and informative. Thank you all for your continued support, and please do take care.